The question here today is, do we practice empathy? I think it would be a big yes from everybody. Today's topic for me to cover is role of empathy for communication amidst optometrists, ophthalmologists, counselors in an ophthalm practice. The whole agenda of empathy, I would take you through what is empathy, why we should practice empathy, and how do we practice empathy. This is a spectrum of empathy which was adopted from NN Group, that is the Neil Norson Group, which is a computer affirmatory firm from United States. If we extrapolate this spectrum to our practice, we have pity at the bottom. Moving up, we have sympathy, we have empathy, and then compassion. Pity and sympathy require no effort, whereas empathy and to be compassionate requires a lot of effort. Pity, you just feel sorry for somebody, and empathy, they just feel for somebody. But whereas with empathy, they feel from the person's perspective. Compassion, driven by empathy, they do take some action and to help the situation or the person. The sociologists have recognized three different types of empathy: emotional, cognitive, and compassionate. Coming to emotional empathy, it's the ability to share a person's concern or pain. Cognitive empathy is the ability to share a person's suffering. Compassionate empathy, you understand the person's predicament and take necessary action to help them in that particular situation. It is vital or essential, especially in our practice, always to differentiate between empathy and sympathy because they have different clinical outcomes. Empathy is a cognitive entity, that is, it is the ability to acquire any factual knowledge that can be tested, whereas sympathy is an affective entity. What we mean by affective entity is it is driven by emotions. Most of the actions are driven by a person's emotion or his feelings. Empathy always has positive, optimal clinical outcome, whereas with sympathy, you have vicarious traumatization. By that we mean there is soul burning, or because there's excessive empathy which is being excised. There is always linear personal growth when we excise empathy in our practice, whereas with sympathy, there is compassion fatigue. Always when we are empathetic, we'll always feel there's a great deal of satisfaction in our career path, whereas with being sympathetic or sympathizing all along, we might have a career burnout. Empathy can be taught at various levels, from children towards, going up even to medical students, whereas sympathy is not easily amenable to changes. What is empathy? The perspective of empathy, you feel you see the world through what the other person's perspective is. That is walking a mile in someone else's shoes. Feeling, you feel with the person, not the other way around. You don't feel sorry for that person. You truly, and in the situation which they are, the deep emotional status they are in, you try and understand. This is what is empathy. Why don't we practice empathy? Where do we lack? We feel threatened often, based on our own fears or our projections or any past, bitter experiences. It often shuts our ability to practice or empathy. Being judgmental, we have already decided that we are right and somebody else is wrong. Even this diminishes our capacity to be empathic. Fear, it's a natural human emotion which leads us to defending ourselves from any threats or being judgmental. Why should we practice empathy, and what are the benefits we reach by being empathic? It's a bi-directional thing. Not only the patient, even the physician reaps optimum amount of satisfaction when practicing empathy. The right-hand side shows what are the benefits reaped by a patient, and the left-hand side depicts what are the benefits reaped by a physician. We build a long-lasting relationship and trust with the patient, which makes us relate easily to the strangers, and we build a compassion. where from the physician's perspective or the physician's point of view, it decreases negativity, that is all the negative spiraling. By practicing empathy, any anger or frustration can be negated by practicing empathy, which reduces stress in the work environment, making it more conducive and more pleasant. It enhances relationships between not only patients and the physician, even with the patient and his colleagues, the doctor and his colleagues, or the doctor and his subordinates. This is the patient interaction. I have depicted it in a pictorial way. When the patient parks and enters our reception, there are various touch points where the patient interacts with various people in the organization. First, they come to the reception desk, they register, giving all their data. Then probably there's a waiting time in the waiting area. They meet the optometrist. After the optometrist, they're sent to the physician or the ophthalmologist. After they have a consultation with an ophthalmologist, they're either, if they require a surgery, sent to the counselor, or if there's a glass prescription or a contact lens prescription, sent to the opticals. From the counselor, they move to the insurance if required, or to the account section where they pay their bills and there's an exit. This slide has a bearing. The empathy scale, which is plotted on the Y graph, physician, has to exercise a lot of empathy. That is why it is on top. This has a bearing on my next slide, which shows a weighing balance, accounts, waiting area, and parking. If somebody falters somewhere, it can be compensated by the physician, optometrist, or counselor, or in the insurance area or the reception. Physician taking the onus, being at the top notch. Exercising empathy will always help us to flourish, or the institution flourishes really well. We always increase our footprints, and of course, it generates revenue. Then how do we improve our level of empathy? There are a few challenges and few consideration points. We challenge our preconceived notions based on the patient's socioeconomic background, or our biases based on anybody's ethnic, cultural backgrounds. Then we should always consider the other person's perspective or other person's point of view. And there's a scientific way where we can, see how we can assess sympathy. This is called the Jefferson scale of sympathy, which was formulated in Thomas Jefferson University in Australia from the Kimmel Medical College. It is a questionnaire which will be handed out. Initially, it was done to evaluate the empathy scale in medical students. Later on, it was extrapolated to physicians and other healthcare providers. There's a clear conceptualization of empathy. And here each respondent is given a score. It can be plotted on a histogram. A lot of statistics can be derived, including the mean, standard deviation, range, and more. And different quartiles can be calculated for the team. This is how a JSE survey or Jefferson Scale empathy survey looks like. There are 20 questionnaires and points are given, rating from 1 to 7. Strongly agree to disagree. They are computed, tabulated, and a total score can be given. And we can just assess the empathy scale in our team, not only the physicians, all our teammates, including the optometrist, the accounts person, or the front office desk. There are other ways to improve empathy. This is only one which I've listed here. Reading literary fiction. It always helps anybody to increase their empathy levels. It's like a role play. You put yourself in the person, the character, and that's how you train. Literature gives us a window to the inner thinking of other people. Not only reading literary fictions, even non-fictions like autobiographies and documentaries will increase your level of exercising empathy. I would like to quote Stephen Covey, who is the author of 7 Habits of Effective People. In empathic listening, you listen with your ears, but you also, and more importantly, listen with your eyes and heart. You listen for feeling, for meaning. You listen for behavior. You sense, you intuit, you feel. You have to open up to be influenced here by Stephen Covey. Any questions I think will be dealt with later. Thank you from Team Zam.